Right now, in your bathroom cabinet, there is something that 78% of adults over 60 use at least once a week. It feels completely harmless. You have probably used it today. Your doctor has almost certainly never warned you about it specifically, and for most of your life, it was harmless. But combined with one other thing that millions of seniors do every single evening, it becomes one of the leading causes of sudden liver failure in adults over 65. The most frightening part is not the substance itself. The most frightening part is that you are most likely using both things separately, feeling completely fine, with no idea that together they are creating a chemical environment inside your liver that it simply was not designed to survive. I'm Dr. James Carter, and today I am going to show you 4 poisons that are silently destroying the livers of seniors across this country right now. I have ranked them from the least dangerous to the most dangerous, so stay with me all the way to number 1, because number 1 is the specific combination that sends more seniors to emergency rooms with acute liver failure than almost any other cause, and almost nobody sees it coming. Before I show you the 4 poisons, I need you to understand something about your liver that most people do not fully appreciate until it is too late. Your liver is the most remarkable organ in your body. It performs over 500 distinct biological functions every single day. It filters your entire blood supply once every 3 minutes. It processes everything you eat, everything you drink, and everything you take in pill form. It produces the proteins your blood needs to clot. It regulates your blood sugar. It neutralizes toxins before they can reach your brain. Think of it as the most advanced chemical processing plant ever built, running 24 hours a day without a single day off since the moment you were born. But here is what makes your liver different from every other organ. It does not have pain receptors the way your muscles or your stomach do. When your heart is struggling, you feel chest pain. When your kidneys are under stress, you feel back pain. But when your liver is being silently destroyed, you feel almost nothing. A little fatigue, maybe. A vague discomfort you write off as a long day. A slight yellowing of the skin or eyes that most people do not notice until the damage is already severe. By the time the symptoms become undeniable, the liver can be 60, 70, even 80% damaged. And a liver at that stage is not coming back easily. That is why what I am about to share is so important, because the 4 poisons I am going to walk you through today are not exotic chemicals. They are not industrial solvents or agricultural pesticides. They are things you take voluntarily, from your own medicine cabinet, from your own grocery store, things you have been told are completely safe, things your doctor probably prescribed or approved. And for many people, they are safe. But after 60, the rules change in ways that nobody sits down and explains to you. Let us begin. Poison number 4. Long-term use of antifungal creams and certain topical medications. I am starting here because this is the one that surprises people the most, and I want you to understand from the beginning that liver damage does not always come from something you swallow. Sometimes it comes from something you apply to your skin. Many seniors use antifungal creams regularly. Athlete's foot cream, toenail fungus treatments, skin fold creams for rashes that develop in warm, moist areas of the body. These are available over the counter without a prescription, and most people use them for weeks or months at a time without ever questioning whether they are reaching organs beyond the skin. Here is the biology that most people do not know. Your skin is not a wall. It is a membrane. A percentage of everything you apply to your skin is absorbed through it and enters your bloodstream. For most topical products in healthy younger adults, that absorption is minimal and the liver processes it easily. But for adults over 60 with thinner, more permeable skin, and for certain antifungal ingredients like clotrimazole and miconazole, when used in large amounts over long periods, the hepatic processing burden is real. The medical literature contains documented cases of drug-induced liver injury from topical antifungal agents, particularly when used under occlusive dressings, in large skin areas, or for extended periods without any medical supervision. Think of it this way. Your liver is like an air filtration system in a building, designed to handle normal air traffic. But if you open all the windows onto a dusty construction site and run the system constantly for months without maintenance, eventually the filters get overwhelmed. The topical antifungals are not a dramatic threat for most people, but they are a load that your liver is carrying silently, and most seniors who use them daily have never been told this. The fix is simple. If you have been using an antifungal cream for more than 4 weeks without significant improvement, do not keep applying it indefinitely. See a doctor. There may be a better treatment approach, and your liver will thank you for not making it process the same compound every day indefinitely. Poison number 3. Non-steroidal anti-inflammatory drugs, commonly called NSAIDs. Ibuprofen, naproxen, diclofenac. You know these. You probably have at least one of them in your bathroom right now. Advil, Motrin, Aleve. They are in virtually every home. They work beautifully for pain, and for occasional use in healthy adults, they are genuinely safe. But here is what happens when seniors use them regularly for the kind of chronic pain that comes with aging. Arthritis, lower back pain, joint inflammation. And here is why this is specifically a liver issue, not just a kidney issue the way most warnings focus. Your liver processes every NSAID you take, every single dose. The cytochrome P450 enzyme system in your liver metabolizes these drugs, converts them into compounds your body can excrete, and neutralizes the reactive byproducts that form during that process. In a young liver with full enzyme capacity, this happens cleanly and efficiently. But after 60, your liver enzyme function declines. The same dose of ibuprofen that a 40-year-old processes in 3 hours can take significantly longer in a 70-year-old, and the reactive byproducts linger. Every time you take another dose before the last one is fully cleared, you are stacking the load on an already slower system. The result over months and years of daily NSAID use is a condition called drug-induced hepatotoxicity. Your liver cells sustain repeated small injuries. Scar tissue begins to replace healthy tissue. The processing capacity drops further, and because this happens gradually and silently, most people have no idea it is happening. There is also a specific combination that makes NSAIDs dramatically more dangerous, and that is taking them alongside blood pressure medications or diuretics, which is extremely common in seniors. NSAIDs reduce blood flow to the kidneys, which forces the kidneys to draw on the liver for compensatory processing. The two organs end up competing for capacity, while both are under pharmaceutical stress simultaneously. The fix here is not to suffer through pain without medication. The fix is to use the lowest effective dose for the shortest possible time, never on an empty stomach, and to ask your doctor specifically about your NSAID use in the context of your entire medication list. There are alternative pain management approaches, including topical diclofenac gel, which delivers the anti-inflammatory effect locally with a fraction of the systemic absorption. Before we get to number 2 and number 1, I need to ask you something. How often do you take ibuprofen or acetaminophen in a typical week? Type your honest number in the comments right now. Not what you think you should say, the real number. Because what I am about to show you in the next 2 poisons depends entirely on that number, and I want you to have it in your mind when you hear it. Poison number 2, acetaminophen, the ingredient in Tylenol, and more importantly, the ingredient hiding inside dozens of other medications that most seniors do not realize contain it. Acetaminophen is the most widely used pain reliever in the world. It is in Tylenol, it is in NyQuil, it is in Dayquil, it is in Theraflu, it is in Excedrin. It is in virtually every nighttime pain reliever, every PM product, every cold and flu medication, every sinus medication, and many prescription pain relievers including Vicodin and Percocet. When taken correctly in the right doses, acetaminophen is one of the safest pain medications available. This is not a story about acetaminophen being dangerous on its own. This is a story about accidental double dosing, and it is one of the most common and most preventable causes of acute liver failure in seniors. Here is how it happens. A senior wakes up with joint pain and takes 2 regular-strength Tylenol. Later that morning, she feels a cold coming on and takes 2 NyQuil capsules. In the afternoon, her lower back is acting up, so she takes an Advil PM because it is what she has. That evening, she takes 2 more Tylenol before bed. She has no idea she has just taken 4 separate doses of acetaminophen across the day in 4 different products, because she was reading the product names, not the ingredients. The safe daily maximum for adults over 60 is 3,000 milligrams per day. Some researchers suggest 2,000 milligrams for older adults with any liver stress. She just took 4,000 milligrams without realizing it. And she did the same thing yesterday and the day before. Your liver processes acetaminophen through a pathway that produces a byproduct called NAPQI. Under normal conditions, your liver immediately neutralizes NAPQI using a compound called glutathione. But when acetaminophen doses are high, or when they accumulate faster than your liver can clear them, NAPQI builds up and begins directly attacking liver cells. Not gradually, not slowly. It binds to liver cell proteins and kills them. This is not a theoretical risk. According to the American Association for the Study of Liver Diseases, acetaminophen overdose, most of it accidental, is the leading cause of acute liver failure in the United States, responsible for 46% of all acute liver failure cases. And seniors are the highest risk group precisely because they take more products containing acetaminophen without tracking the cumulative dose. Think of your liver's glutathione reserve as a fire extinguisher, sized perfectly for the expected load. But if 4 separate products are all starting fires at the same time, the extinguisher runs out before any of them are under control. And once liver cells start dying from NAPQI accumulation, the damage can be rapid and severe. The fix is to read every ingredient label, not just the product name. Look for the word acetaminophen, or its abbreviation, APAP. Add up every source you take across the full day. Keep a total below 2,000 milligrams per day if you are over 60, or below 1,500 milligrams if you drink alcohol in any amount. And before you take any new over-the-counter product for cold, flu, sleep, or pain, check whether it already contains acetaminophen. And now, poison number 1. I want to tell you about Robert. Robert was 69 years old, retired, in good health, nothing remarkable in his medical history. He had lower back pain from decades of physical work, so he kept Tylenol PM on his nightstand. 2 tablets before bed most nights. It helped him sleep, and it took the edge off the pain. He also had a glass of red wine with dinner most evenings. 1 glass, sometimes 2, nothing dramatic. He felt fine. There was no reason to be concerned. Neither of these things alone was a problem. His doctor knew about the back pain. His doctor knew he had a glass of wine with dinner. Nobody had ever connected the two. 14 months later, Robert was in the emergency room with acute liver failure. Poison number 1 is not a single substance. It is a combination. Acetaminophen and alcohol. Even moderate amounts of each. Even the amounts that individually pose no significant risk. Here is the chemistry that makes this combination so dangerous, and I want you to understand this clearly because it is not intuitive. Alcohol and acetaminophen compete for the same metabolic pathway in your liver. When alcohol is present in your system, your liver partially diverts its processing resources toward clearing the alcohol first. This slows the normal acetaminophen clearance pathway and forces more of the acetaminophen through an alternative pathway, one that produces significantly more NAPQI, the toxic byproduct we discussed in poison number 2. Simultaneously, alcohol depletes your liver's glutathione reserves. Glutathione is the compound your liver uses to neutralize NAPQI before it damages liver cells. So at the exact moment that your body is producing more NAPQI than usual because of the metabolic competition, it has less of the substance it needs to neutralize that NAPQI. More toxin, less defense, simultaneously, every single night. And here is the part that stops people cold when they hear it. The FDA warning on acetaminophen products states that people who consume 3 or more alcoholic drinks per day should ask their doctor before using acetaminophen. 3 drinks. But the research on combination toxicity in adults over 60 shows that the dangerous interaction can begin at much lower levels of alcohol consumption than most people would consider significant. 1 or 2 drinks combined with standard acetaminophen doses in a liver already showing any age-related decline in glutathione production creates a measurably elevated risk environment. Robert was not doing anything reckless by any conventional measure. He was taking a standard over-the-counter pain reliever before bed and having a modest amount of wine with dinner. Nobody told him that together, consistently, over more than a year, this combination would create conditions his liver could not recover from. I am telling you now, if you take any acetaminophen-containing product on a regular basis and you drink alcohol in any amount, please have a specific conversation with your doctor about this. Not in passing, not as a footnote to another appointment. A dedicated conversation about the timing, the doses, and the interaction. Because this is not a rare edge case, this is one of the most common preventable liver injuries I see, and it almost always involves seniors who were simply never told. Drop a comment right now with your honest answer. Do you take Tylenol or any PM product regularly and also drink alcohol in the evenings, even occasionally? Just type yes or no, no judgment. I read every single comment on this channel, and your answer might be the most important thing you do today. Let me bring you back to where we started, your bathroom cabinet, the thing you use without thinking. Your liver has been silently protecting you for 60, 70, 80 years, processing every medication, every glass of wine, every painkiller, every antifungal cream, every cold tablet without ever asking for anything in return, without ever sending you a pain signal severe enough to make you stop and listen. But silence is not the same as safety. And the 4 poisons we covered today are dangerous precisely because they ask for nothing until suddenly they have taken everything. Here is what I want you to do before you go to bed tonight. Go to your bathroom cabinet and take everything out. Every pill bottle, every cream, every over-the-counter product. Read every ingredient label and find every product that contains acetaminophen or the letters APAP. Count them. Then think honestly about how often you take them and whether you ever drink alcohol on the same day. If you take NSAIDs regularly for chronic pain, write down how many days per week and bring that number to your doctor. Ask specifically whether your frequency and dose is safe given your age and your other medications. If you use topical antifungal creams or any topical medication in large amounts over large skin areas for extended periods, mention it to your doctor. It sounds minor. It is not always minor. And if you take any acetaminophen-containing product and drink alcohol in any amount, please have that specific conversation with your doctor this week, before another 14 months goes by. Your liver cannot speak for itself. That is why I made this video. Consider it the message your liver has been trying to send you. If this video gave you something important today, please share it. Think of someone you know who takes Tylenol PM before bed and has a glass of wine with dinner. Send this to them right now. Not because you want to alarm them, because you care about them, and because they almost certainly have never heard any of this. Hit the like button if this opened your eyes to something your doctor has never explained. And subscribe to this channel because every single week I bring you exactly this kind of honest, practical information that the medical system simply does not have time to sit down and share with you. I will see you in the next video.